Voices of the World brings you first-hand stories about the triumphs, tragedies, and turning points that shape human lives. Hello.
Bonjour.
Servus, grüß euch.
Swagat.
Hasta la próxima.
Now streaming, listen in to this true story.
Hi, I'm Robert Longyear. I'm from Marietta, Georgia, and now live in Washington, D.C. And I'm the author of Innovating for Wellness. It's a book about how the healthcare system can innovate and is currently innovating to actually make substantial changes to how we deliver healthcare services to patients. I'm from Marietta, Georgia, like I said. I started school at Wake Forest University in Winston-Salem, North Carolina. I really wanted to go to medical school, so I went there. It was a small liberal arts school in the middle of the woods. I could spend my time studying for the MCAT and studying to get into medical school. But about halfway through that year, I decided that I really wanted to go someplace where there was more opportunity, there was more interaction on sort of a larger scale. So I actually ended up transferring to Georgetown University in Washington, D.C., where I wanted to study healthcare management and policy and also continue trying to go to medical school. It was at that time I started working for a pharmaceutical company in the lab for about a year and a half on experimental nanotechnologies to deliver drugs to cells in a more targeted way. I worked for them for, like I said, about a year and a half. And I learned that being in the lab just really wasn't for me. There was a lot of solo work. It was very intricate. There's a lot of mistakes that could be made if you didn't pay a whole bunch of attention. And I was just a little too social for that. So from there, I went to a consulting company called ICF, where I got to work on some really cool projects, one of which was working with the Food and Drug Administration on looking at Juul and e-cigarettes and the regulations for that. So I got to work on a project there. We know that that's pretty big in the news. After ICF, I got really interested while studying healthcare management and policy at Georgetown in sort of how we pay for healthcare. So the payment side of things, health insurance, government-sponsored health insurance programs, Medicare and Medicaid. So I went to a Medicaid managed care company over the summer and worked in quality improvement, where I really got to learn sort of how the government essentially pays for Medicaid services for some of our highest cost, highest need patients in the country. And I learned a lot about what went well and what didn't go well. After that summer, I came back to school. I went to start working for Medicaid Health Plans of America in their policy department. So I got to see sort of the higher level, industry level issues that were associated with my work that I was doing sort of at the local level. And really learned a lot about sort of some of the bigger trends in healthcare payment, such as value-based payment. And that's sort of part of what one of the parts of the book is, instead of paying for healthcare services based on how much is provided. So if you go to your physician's office and you get a bunch of tests done, they get a certain amount per test, they get a certain amount per visit, and that just really incentivizes them to provide a whole bunch of care. But it doesn't incentivize them to provide really effective care. And so it doesn't necessarily keep patients healthy when the incentive is to keep patients coming back to a facility. So while I was at MHPA, I really got to do a pretty deep dive on some of the value-based payment philosophies and value-based payment structures that were being developed to try and get delivery systems, physicians, and hospitals to more effectively deliver quality care to patients so that they weren't coming back to the hospital. So instead of paying for volume, you pay for patients being healthy, essentially. So I started really getting interested in that, and I started working on my thesis before I graduated on some of these really innovative payment models that were being introduced in some of the states. And so I learned a lot during that process, and I realized that I had a lot there. I learned a lot of the challenges. I did a lot of interviews with people who were implementing these programs in states. And so I got very interested and identified a lot of key problems, one of which was technology. It was during my senior year at Georgetown that I started working with some digital health technology startups. I started one in last January and a couple more after that because I started getting really interested in the space. So I started working with them. I ended up meeting the CEO of a company called Montuno Software in June. And this was at the same time I was working for MHPA and the Institute for Medicaid Innovation, where I was doing research on a lot of these similar programs that also, my research also highlighted the need for really good technologies to be able to improve healthcare services. And so I started working with the CEO at Montuno Software, and I realized that this mobile app that they had really had the potential to provide some of this key information to the health system to better provide care for patients under value-based payment systems. And so I started working with Prob, the CEO, full time in product management. We started, really trying to build an enterprise product for healthcare payment delivery systems that are trying to be operating under value-based payment. And so I learned a lot between sort of the research side and policy and the technology side of actually working for one of these innovative companies. I was in a meeting when I was working for the Institute for Medicaid Innovation, and it was with a bunch of really world renowned policy researchers and state Medicaid agencies. And they were all policy people. They were trying to institute value based payments in their states or in certain programs. And they all kept saying, oh, we'll use data to get this, or we'll measure this, or we'll measure outcomes. And there was nobody in the room that was a data person or a information technology person or a digital health technology person. They're all policy people talking about how they want their value-based payment systems and their methodologies to be successful at changing how we provide healthcare services, but they were missing a really important part, the technology that actually lets this happen, the information that lets this happen. So I realized that was a big problem going forward. So in June, I got a phone call from a professor at Georgetown asking if I wanted to write a book. And I said, absolutely. So I took sort of my thesis work and I took my new experience with digital health company and I combined them into a book to talk about how the innovators and how innovation in healthcare through the lens of payments and technology can actually really change the way that we provide healthcare services to patients. And this is really important. The healthcare industry is very aware of the problems. We know that we spend more per person on healthcare than any other developed country in the world. We know that we have worse outcomes. The healthcare system and the services provided are not as effective as other countries, and our population is less healthy. And so I really learned through some of this work that the two technology and payment really need to work together to better improve the system, and to fundamentally change the way that it works. And what that kind of looks like throughout the book is the healthcare system as it is today. A patient gets sick, they go to a healthcare organization, they go see a physician. Physician examines them, does some tests, figures out what's wrong, and recommends a treatment and sends them home. And then the patient is left alone to go home and sort of manage that condition. And hopefully it goes well. But if something goes wrong between that point in time and the next appointment, then the patient really ends up in the emergency department, ends up in the hospital. And so there's no guidance, there's no monitoring that's occurring outside of the four walls of a healthcare facility. And so for value-based payment to be successful, where we try to keep patients out of healthcare facilities, we try to keep them healthy and in the community, it really requires that there's a bridge that's built between the healthcare system and the patient's daily life. And so that's where the technology comes in. And my book really focuses on mobile technology in particular. So that's apps that are on mobile devices and smartphones. That's wearables like smartwatches that can track electrocardiograms and heart rate and activity. All of these really important factors that are associated with people's health and how well their diseases and their chronic diseases are handled. In particular, it focuses on programs and systems and technologies that can help support patients with chronic illness. We know that in the United States, chronic illness makes up about 75% of healthcare costs. These are diseases like diabetes, chronic obstructive pulmonary disease, congestive heart failure, cancers. These are things people have to live with for a long time. We know that they cost the system a whole bunch of money when they get out of control. They're not adequately managed. And we know that the system that is built today is not built to help patients manage these conditions. The system is built to handle like extreme episodes that require a lot of intensive services and not daily support. And so that's what the system needs to change to be more reactive. To be more proactive rather than reactive, and to utilize technology to better predict patient risk, to better communicate between patient and physician when the patient's in the home. And so the book really focuses on this environment for really important healthcare changes that is coming out of some of these policy changes that have to do with payment towards a value-based payment system, and the kind of merging with technology that is building up the ability to actually help achieve the outcomes goals of these value-based payment programs. And so that's really what the book is about, but it's told through really interesting stories. So part of my motivation for writing this book is when I was in college, I actually lost my mom to chronic myeloid leukemia, and the episode of care we had for 6 months while she was in and out of the hospital, and we were helping manage her care at home and going to a whole bunch of different physicians, really was the best teacher for how our healthcare system works today and how it needs to work tomorrow. And so the part two of the book is about sort of that experience and that journey, sort of told through the eyes of a son and a caregiver, but somebody who's studied the system, who knows why things are happening the way they're happening. And I think it's very illustrative of the future of healthcare can actually look like when innovation is done in a way that can actually impact the way patients experience care in a way that actually can help patients achieve a better stability in their conditions. So that's the book in a nutshell. I was really motivated to write it because I felt like I had kind of a unique experience with being in a technology company and working in sort of policy and payment issues. And so kind of those two fields don't often interact with each other, but they're very important and they are co-reliant, but the interaction doesn't occur as often as it should. So I felt like it merited a book. I felt like my story and my mom's story of care was something that's important and that can sort of help illustrate how some of these new innovations can help change the healthcare system for the better. So that's what the book's about, and glad to be here on the podcast talking about it. So I'm excited to announce that the book's supposed to be published in April 2020. My publisher is New Degree Press, and it will be available on Amazon, and just Google Innovating for Wellness. You'll be able to find it. My name is Robert Longyear. You can find me on LinkedIn. I post quite frequently about digital health, mobile health, and sort of health innovation. So I have some pretty good content and some pretty interesting things, I think. And then you can follow me on Twitter at RL and hope to interact with you in the future. So the book is not just a whole bunch of research that's thrown together. I originally kind of just wanted to take my thesis and turn it into a book, but I was told that people don't want to read that, and that's very true. So I did a lot of interviews with people that either created some of the innovations I talk about or are building new ones. And I added that to my own personal stories. And so it's a pretty engaging book. It's very human. It's very focused on the patient. It's very focused on the fact that all of us will be patients someday. One story in particular, I interviewed Dr. Elliot Fisher at Dartmouth. He is the father of the Accountable Care Organization. He is one of the pioneers for value-based payment. His research kind of set the basis for a lot of the big changes in health policy these days, but he started off as a young medical student when he started having some of these ideas. And I tell his story a little bit, and how his contributions to the field of healthcare have started to impact patients. I tell stories about some innovative healthcare startups. So I talked to Taylor Justice, who's the president and co-founder of Unite Us. They're a social service technology platform for social service organizations and healthcare organizations to sort of coordinate and share care through a network. And so they have a wonderful product that's being adopted across the country today. So I get to interview him and hear the story of how that company came into being and, sort of how they came up with the idea. That starts out the book and it sets a sort of a foundation for what good innovation looks like. It's innovation that really affects change at the patient level. It's innovation that helps focus in on individuals and to better tailor services to those individuals. Because at the end of the day, we measure healthcare improvement across the country, across bigger populations, but those changes have to occur in individuals. Those individuals have interactions with the organizations and with the systems and with physicians. And so, unless something happens for those interactions to change, to get better, and for patients that those individuals to actually have improved health, you're not going to necessarily see it population level. So that's kind of one of the core themes is we need to build the system for the end user, which is the patient. So to be able to do that, you need to have the incentives in place from this value-based payment, from accountable care organizations like those set forth by Dr. Fisher. And the digital health technology really enables these programs to be successful. In order for value-based payment to work, you have to actually be able to affect changes in patients. You have to be able to help them attain better health and stay out of the hospital. And so you need technologies to change the way that we provide healthcare services. Without it, without becoming more proactive, it's not going to be successful. So I tell stories about that. I go into a good amount of detail about my mom's care journey from when she was first diagnosed with chronic myeloid leukemia to when it got out of control and she was rushed to the emergency department and then the hospital for 6 weeks. And I talk about a lot of the really important things that we experienced during this time that were either really good or that really need to improve in order to provide better care to our highest risk patients. When my mom was released from the hospital, she was still fighting the leukemia. She was on a new drug for that, had gone through chemotherapy. She was a congestive heart failure patient, and she had an infection from the fact that her immune system was affected by the leukemia. And so she was a really high risk patient with multiple chronic conditions. And these are the people that cost the most money to the healthcare system because it's hard to provide good services to them. We got out of the hospital and we were seeing a cardiologist, we were seeing her oncologist, we were seeing an infectious disease physician, we were seeing a gastroenterologist, and we were seeing an eye surgeon. And those five physicians don't communicate with each other. They're all specialized organizations, they don't coordinate care. And one story in particular that was was very important and very instrumental in sort of how I see the importance of technology in healthcare is they all prescribe their own medications and they don't know what the other ones have prescribed. So we were sitting there carrying around a pink binder, writing down all the information from each of these physicians to make sure that we had a central record. But the health system should do that itself. They should all know what patients are seeing, and so that's a big failure. And I remember one particular incident. She was a cancer patient, and she was on a new cancer drug that is very important to making sure that the cancer is controlled and treated. But she was also prescribed a medication for, I can't remember what it was, that is shouldn't be prescribed and taken at the same time as the cancer drug because it makes it less effective. And so, her gastroenterologist prescribed this other drug. We picked it up at the pharmacy. And fortunately, I have enough experience in healthcare to know that I need to check out these interactions because I can't expect the system to do it for us. And so I went online, looked at all the drug interactions, looked at some clinical studies, and I found out that these two drugs should not be taken at the same time. So I was fortunate because I have a healthcare background. I worked in a cancer lab. I was able to understand clinical research. I was able to look at some of these different interaction checkers and make these decisions and pull some pharmacists in on it. But most people in the country can't do that. And so it's up to the system to be able to provide these services and to make sure that these bad drug interactions, this is just one example of a lot of the things that go wrong in US healthcare, to make sure these bad drug interactions don't happen for really high risk patients, for any patient really. So, I realized that this drug that was prescribed that we had already picked up and were about to give to my mom would have made her cancer treatment less effective. So I called the pharmacist at the oncology clinic and I said, we were just prescribed this medication. I think it's the word is contraindicated in healthcare language. And the pharmacist looked it up and said, yeah, don't give her that drug. And I said, had I not checked and known that I need to check this, her cancer treatment would have been affected by that. And this happens every day in the healthcare system. And technology really has the ability to make sure that everybody's aware of the drugs everybody's taking. And there can even be analytics and automated checkers in there to make sure that what's being prescribed is not contraindicated. And we know that happens in a lot of places today, but it's just not done on the scale that it needs to be done. And so I talk about issues like that to better explain the innovations and the points that I discussed in the book.
Goodbye.
Au revoir.
Good day.
Alvida.
Hasta la próxima.
Voices of the World is produced by iUSA Radio and Podtex, a team that helps you to build a community podcast station and stream the truth about your city. To learn more and start building your own podcast business, go to www.streamthetruth.com.